All right, welcome back, everyone. So, did you enjoy the lunch? Did you? Can I hear some noise? Did you enjoy the lunch? Yes, thank you. Right, so we are coming back for the session 4, the thematic discussion 2, strengthening care systems for health and well-being in OH, a life course perspective. So these sessions, we will focus on promoting health and well-being, as the name said, through the preventive care and continuous health support across the life course. So it's going to be highlighting as effective strategies, institutional frameworks, and community engagement models to ensure that older persons have access to inclusive, high quality, and sustainable healthcare services throughout their lives. And today we have an honor from Associate Dr. Professor Dr. Tongjit Rittikrong from the Institute for Population and Social Research, Mahidol University. So, Professor, if you are ready, the floor is yours. And a big applause to our Associate Professor Dr. Tongjit Rittikrong.
ค่ะสวัสดีค่ะ Good afternoon and welcome to the afternoon session. It's always challenge for the session after lunch, so I will do my best to keep you awake, and also my panelists will help me as well. So, welcome to the session Strengthening Care System for Health and Well-being in OH, a life course perspective. So may I invite all of our panelists today. First, Professor Dr. Yutaka Hori. Please give big hand for him. The next person, Dr. ภูสิทธิ์ประคองสายค่ะเรียนเชิญค่ะ Next, Miss Pim Siri, ผู้บรรทัด from Kinan Foundation Asia. And next, Mr. Jere Vichathai, please. And the last person, Mr. เก่งพงษ์ตั้งอรุณสันติเรียนเชิญค่ะ So I will take the opportunities to introduce our panelists, each person before their presentation to keep the time. So let's get started to, sorry. About 10 minutes each. Yes, I will let you know when you have 1 minute left. Okay. So the first person, so may I invite Professor Yutaka Hori. He will give the presentation about from universal coverage to active and dignified aging, Japan's path from policy to practice. So allow me to introduce him a little bit. Professor Hori is the advisor to chairman of the board of the director, and he is the director of Center for Diversity, Equity, and Inclusion, or DE&I, promotion of inclusive society at Fujita Health University in Japan. Professor Hori has been serving public service for over 30 years in health and welfare for Social Security. He played roles in drafting the current infectious disease prevention law and also social welfare law. He was Secretary of Ministry of Health, Labor, and Welfare between 2000 and 2004. And he also started community development project on aging in Thai government between 2007 and 2010. So if you're ready, please come.
Thank you very much, Dr. Jingjit. Is that correct? Jongjit, Dr. Jongjit. สวัสดีครับทุกท่านชื่อดร. Hori นะครับสบายดีไหมครับ Are you sleepy? No? Okay. Thank you very much, first of all, for MSDHS and Chulalongkorn University to invite me here. And then anyway, Japan is top runner for aging ratio. Well, everybody will follow Japan in that sense. So I try to focus more on current issues or challenges than success story of Social Security in Japan, because you will know where you have trouble in future. Okay. This is the illustration. Okay. Thanks to Dr. Jung Jit, I was in Thailand for 3 years as a starting chief advisor for CTOP project, a community-based integrated service for the elderly, between 2007 and 2010. So actually, Jinjin Leo, Yakja U Team One Thai, John Thai. Open Cup. Actually, I said I want to stay in Japan, no, Thailand, till I die. Okay, 10 minutes will pass soon, so I will go for. This is the campus of my university. Oh, by the way, as was introduced, I was basically working for government for nearly 30 years. And then now I'm a professor at Fujita Health University with the largest pets hospital in Japan. Okay, as I said, I will show what is the issues of Japan, not how we achieved. When older people meet, what do they talk about? In Japan, people talk about topics often according to their life stages, okay? In 20s, very young, like you, they may talk about employment, leisure, or maybe marriage. In 30s, maybe about the careers, family, especially kids. In 40s, maybe about purchasing houses or promotion at work. Indeed, do I cup? But peak of their pure, bright stories comes, finishes, ends sooner or later. In 50s, they may start talking about care of their parents and about their own health issues. In 60s, about their retirement and pension and fun to play with their grandchildren. When you ride on public transportation daytime, like BTS or something, daytime in Tokyo, you cannot help hearing older people say, oh, I have to complain. I have to go to that clinic because I have this problem or what, something like this. So my point is aging about contests of complaints and contentment, okay? What older people often talk about are complaints about limited income, savings, inflation, health concerns, or the potential need for long-term care. This part, we have already focused on it. We are kind of already solved the issues. Social policies, as in social security system, try to respond to these complaints through healthcare, pension, daily assistance, other welfare programs, and long-term care. So if you have any questions, I'm glad to answer that, but I'm going ahead of it. But do these systems really deliver contentment? Are you happy? Something like this. Then maybe older people still sigh. Oh, they feel so isolated, unheard, or feeling useless. As Japan leads the world in aging ratio, maybe Japan also needs to lead in listening. This presentation invites all participants today to reflect together on how social system can support not just care, but contentment. This one, you can look at the statistics in your here. You scan here, and then you can read it. So I skip it, but Japan, median age is 49, and then Thailand, 39, and then maybe Philippines, only 25 or something like this. So very different. And the total fertility rate, Republic of Korea is 0.72. And then Philippines are known as many friends country, but now the total fertility rate is below 2 at this moment. Okay, so this one was explained by many professors, like European countries was aging very slowly. Japan was much faster, but Singapore, Korea, China was faster than Japan. Wait for 1 second to take a picture, because this doesn't contain Thailand. Okay, here. Thailand has 18 years, just as Vietnamese or Korea. So my conclusion at this moment is steep climb toward aging society. Maybe this is Japan. Does it look like me? Oh. So Japan is top runner, but ASEAN countries are facing steep climb into aging society. Japan's 3 universal insurance system, you know it already. Universal healthcare, universal pension system, universal long-term care system. Again, if you have more concern or whatever, I'm ready to answer you anything. But we have started universal health care and universal pension more than 60 years ago, and universal long-term care year 2000. Okay, universal, okay, this is skipping. So what social policy covers and what it misses? Japan's insurance system can give you satisfaction in healthcare or some daily living, whatever. But these things, okay, do not ensure individual fulfillment. Social policy well covers hunger, accident, violence, disease, poverty, thrust, but not necessarily response to reskilling, as Mr. Ken explained. Don't go away. Choice of lifestyle, appreciation from organization, community. These are a bit more difficult to respond by Social Security. Okay, I put Maslow's hierarchy of needs. So physiological needs, safety needs are well covered by Social Security, but belongings, self-esteem, like or approved by community, are difficult. And then self-fulfillment, de-skilling for future choice of lifestyle is a bit difficult to outreach from Social Security. Okay, this is one good example. What fulfills you, like for full satisfaction, is maybe very small things like grandchild escort. You feel you are asked, requested, and you are helping younger families. So self-actualization, belonging, esteem, and multiple respect enables sustainability. Very simple. You can see anywhere in the world like this, but this is fulfillment for the elderly themselves. So policies promote psychological needs and fulfillment. So that was what people, today we discussed community integration care and inclusive society, technologies to promote and support older people, and multi-layered support. This is pretty new in Japan, so this is a takeaway for you. And then healthy aging, active aging. I try not to run out my time, so I will skip community integrated care. Well, easy. You can stay home and take any health care or social services. And promotion of inclusive society, where we have law like this, you can see in the document. And then basic law on the inventor to promote inclusive society. We have this law last year. And then, well, technology and policy work together. So what does it mean? People is saying bye-bye to maybe their old parent. Okay. And then what this illustration intends to show, this is city office. He is thinking of some walking stick, and the office worker is thinking something else. Old person visiting city office just for walking stick, but city official is raising such other issues as bedridden spouse or high school grandchild who takes care of her grandmother by giving up her time for study. So what he really needs is not just for walking stick, but for other issues. Those things we learned this morning from many professors, like comprehensive care or whatever. But at this moment in Japan, multi-layered comprehensive support is in place in cities. So not necessarily in welfare part of city office, but some life support system, like combine any services. So this is multi-layered comprehensive support is new and hot in Japan. Feeling isolation, loneliness, support may include spouse health, daily care, grandchild education, housing for the old couple, application of assistance, community activities, protection from abuse or neglect. If these issues are brought together in one-stop service, then, look at him, so different, like feeling connected and happy. Multi-layered support is hot on agenda at this moment in Japan. And healthy life expectancy is important, and this is 1 second information from Fujita Health University. What I am doing now, like inclusive farm. student, staff, persons with disabilities working together. The Olympics for the people with hearing problems is to be held in Japan in November this year. So I connect Deaf Olympics champion to invite him to classes for student and nursing department and AI-assisted discharge instruction sheets. When you are getting out of a hospital, information should be more or easier to support people what to do after dischargement. But so I'm starting a new project to using AI to make this document easy to understand and also to conduct by elderly. And also oral frailty is under my interest at this moment. So closing message, what Japan can share and cannot. And lessons, funding models, community care innovation, limits, culture-specific solution may not translate. Human story is the most transferable lesson from universal coverage to active and dignified aging. And after all, this is not just about systems, but about people. And then finally, let's older person are not always for protection, but for their contribution. Let us promote a society where aging is not endured, but embraced. ขอบคุณครับ
Thank you very much, Professor Hori. So we learned a lot from him. So he mentioned that he learned from the complaints about the limitation of the resource, and then he turned the complaints to be social policy and also to be social security in many dimensions, including psychological needs and community integrated. And we are talking a lot about using AI to help older person, but he also mentioned AI is not the final answer, but we have to remain our family members to take care of our older persons in our society. Thank you very much, Kat. So the next person, may I move to Dr. Keng Pong? Dr. Keng Pong, sorry, is a medical doctor. He's going to give the presentation in Partnering for Better Aging, Mobilizing Senior Health Services to Support National Care System. Dr. Keng Pong is the Director of Surgery Home International Elderly Hospital and Rehabilitation Center. He is the CEO of KPN Senior Hospital and President of Senior Health Service and Trade Association of Thailand. And this is my impression. He is motivated by experience of caring his grandmother who is approaching 105 years. So please, Dr. Keng Pong.
Okay, thank you. Good afternoon, everyone. Today, so I'm so pleasure to be here to sharing about the seniors care work that I worked for 10 years from Just Hope International Hospital and the association that involving about the seniors care, senior housing, and seniors living in Thailand. So as you know, the senior citizens of Thailand is growing very rapidly. Last 10 years ago, maybe now we are second rank of the seniors population in ASEAN, but the rapid move very rapidly about increasing maybe number one in ASEAN in next 5 to 6 years. So this is a big challenge of Thai people, Thai government is impact. It is like a tsunami of the population that going to the shore and maybe destroy everything that we have, like about the politics, about the healthcare system, about the economy. It's very challenging for us to solve these problems. How do we can uh, can create the new solution for Thai people that we can care our seniors with quality of life, with quality of care. So this is the big challenge that we have established very strong uh, foundation of the healthcare for Thai people many years, maybe at least to 30 years. We in the past we focus on centralized healthcare because in the past we focus on create or establish about the acute care hospital, this specialized hospital that care specific diseases. But from now, we should change to be decentralized healthcare because, you know, when you see the patients in the hospital, mostly it is reach to 70 to 80%. They are seniors. They take a lot of resources, lost our money for care the patient who are under diseases. We should focus to be or strengthening about health promotion and health prevention is the most key of our success for the healthcare. So that's why I would like to I work in our association for care the seniors, and we look forward in the future. How do we, like my grandma, as you mentioned, live over 100 years? Is it possible in nowadays that we live? And we trust about we can create a solution for Thai people that I mentioned in the beginning, changed from centralized healthcare to be decentralized healthcare is maybe the successful solution for Thai people in the future. This is a number that we started in the senior population market. When we look at the hospital, acute care hospital, we see 70% they are seniors. They just discharged from the big hospital with many complications like a bedridden status, with malnutrition, lost their energy, easy to reinfection again, and take a lot of resources from their family, from the government to support them totally. But for the long-term care, who pay? Do you know? For Thai people, for long-term care, for rehabilitation, hiring caregivers who pay just out of pocket. So when I have my grandma, she's 105, that she needs nursing care, she needs 24-hour caregivers taking care of her. She needs rehabilitation. We pay out of pocket. As you know, when the people age they reach to 80%, 80 years old, they should pay for a good quality of life. They spend for maybe 50,000 baht a month or 80,000 baht a month for hiring the professionals who care them. So that's why about the segmentation that we focus on services for Thai people. 70% need home care, hiring caregivers, hiring nurses to care patients at their home, at their residence. 20% for nursing home, 5% for daycare, and 5% for the seniors care hospital or geriatric care hospital. Is quite different from Japan, right? Because the Japan go into the ideas of decentralized healthcare for many years. When we see the good model for the Western countries, developed countries, of particularly in Japan or like in Austria, in United States, we know about we know about the good practice about decentralized model. Um, especially the concept of aging in place living, aging in place care, daycare model, and decentralized healthcare center in the community. This is our work. My association that work really closely to Ministry of Public Health, Ministry of Commerce, and Ministry of Labor to be set the new standard or a new solution for seniors care in Thailand. We work and cooperate with the insurance. We start at the private insurance too, because we know about to involving to change the policy, the regulation is take very long time, maybe 10 years. It's very hard to be to make the new things open, established well in the short term. So we gonna cooperate with the private sector first, because it's ready to move and it can create a new paradigm of the seniors care really quickly. We know we have the triangle. You know, when we saw the success model countries like in Japan, in EU system, in America, first we should have the landlord or the land provider that can establish healthcare center, establish the training caregiver training center in the community. The second party is the operator, like us, like a tertiary home, like a nursing home association, that we work to operate the good quality of care and standards of care in each center in the community. We provide the skilled caregivers. We provide the experienced nursing team that can care the patients very well, prevent them from the complications, and improve them as quickly as we can to return them to the community safely. And the third one is a payer. You know, it's like a government policy payer, like an insurance payer. We should create the triangle happen in Thailand as soon as possible, because when we lost this triangle about the ecosystem, about the economy will collapse in very few years from now. And the Thailand now, I think, is a bright side, because nowadays in the private sector, the private insurance like a มืองThai Life Insurance, Thai Life Insurance, or the global insurance like a AAA, Cigna, we can mention them that, because it's a very big issue that from our association we collaborate and point them about the important roles, important things that we should make something to happen together, complete this triangle to be settled down and make the sustainability work for Thai seniors living business in Thailand. It's like this is my ideas that we create from 10 years that try to be senior care solution. I start with my private company, but we would like to be the first comer to show the government, to show the Thai people that we can create CCRC model. CCRC model is community continuous care retirement committee happen in Thailand. For my work at the tertiary home, we create the hospital, seniors care hospital. We create the nursing home, big size, medium size, and small size, and then home care too. I think it's like for the overview. I would like to show you this is a bright side in Thailand. We create the first draft of triangle now, and for the near future we would like to be strengthen up the T parties in the triangle to be create the sustainability framework for Thai people and sustainability for Thailand, for senior of Thailand. Thank you.
Thank you very much, Dr. Denpong. I like the way that he started with the 100-year happy living solution. Actually, at IPS Mahidol University, we also have a study about centenarian. So if you like to study more about this, so please come to our website. Yeah, we cannot deny that public service is not enough to take care everyone in our community, but we also need the private sector to create the opportunity, the service to take care of our older person. So we probably learn from Dr. Keng Pong, and he need to leave us soon. So if you have any questions, so please leave for him, and then our organizer will leave, we will send a question to him. So let's move to the next presenter. May I ask Dr. Tere ค่ะ Sorry, we reorganize a little bit ค่ะ Dr. Tere will give the presentation about aligning research funding with health impact primary and community-based care for older adults. Mr. Jare is a researcher at the Health System Research Institute, or HSRI in Thailand. He is responsible for research planning, grant management, and ensuring research finding translate into practice and policy. His background is about dentistry and received his master in health science. He also played key roles in establishing Thailand's universal health coverage policy and also National Health Security Office. Please, Dr. Tere.
Thank you, Dr. Chongtit. Good afternoon, everyone. Before I start, I really want to explain why I need to talk about this topic. Is it because I'm from the Health System Research Institute, a research funder, and therefore we are thinking about how we're going to fund the research to be more transformative for promoting community health care, in particular to long life cost perspective, right? Okay, because I'm not an expert in elderly, but I'm getting old. I'm trying to understand how I feel when I'm getting old. My stuff, next, okay. I'm trying to find out, based on my experience and my insight from my research management experience, and really, I have to talk about the community-based care or primary care. We all know that primary care is a gatekeeper, but I'm not talking about a traditional primary care system. We really badly need a more effective primary care system, which really want to focus on individual lifespan. With this sense, we really need better health outcomes, right? Because everything we do, everything we deliver to the patients, the elderly population, or whoever, we need to measure how well we can perform on this system, right? Second thing, we know that primary care system approach, we have to focus on how social determinants of health are interrelated with health outcomes. And more social determinants of health actually external to healthcare system. For example, your socioeconomic status, your residential areas, whatever. So therefore, we need to know or understand how it relates together. Third thing, or fourth thing, to anyone who really manage the primary care system, they need to understand the complexity of how the social determinants of health are related to health outcomes. Therefore, they can manage or make the decision better on, the public health programs. Next slide. I give you some of the literature how significant the primary care and community health care based care are very important to, if we talk about the life course approach. Okay. The third thing I really want to focus, because when we say in Thailand, you are getting old because you are becoming 60. I'm 57, I'm getting old. But actually, when we say about aging, it doesn't start at 60, really. It starts from when you were born. Anyone, when you are born, you are aging, you are in the process of aging, but you feel getting old when you becoming at the middle age, right? Like me, I'm feeling tired right now, I'm sleepy. Okay, in terms of research areas, if we talk about we go to the earlier stage, We need to focus on the research, particularly on the screening topics in the technology, in behavior changes, things like this, very important. However, our staff at primary care may not be understanding these issues, or maybe because it's hard, because they have to work across sectors, across settings. Community-based lifestyle, very important. I don't know how many programs in Thailand have the integrated care between social and healthcare that support the community-based lifestyle. Any program, any evidence on that? I'm not sure. The third thing, I think we need a transition package focusing on the middle-aged population. Possibly of when you are reaching 50 age, you need a transition care package, not only the financial matters, but also your health and how you going to manage your health, your lifestyle, your active functionality, things like that. And the last thing, basic thing here, right? Because we already talked about this thing, and I also see the flip chart saying that we need integrated care service between health and social care, right? And this is very important one. You don't know where you are if you don't know the data. We need the more effective data. The data which covers all important key indicators, not only clinical outcomes, not only health outcome, but also social indicator as well. So if you know the data, you know the information, you can analyze to get more insight on each individual. Then you can more customize the program for each individual. And the thing is, if we have the more effective data, I think we can use the data for informing the policymakers. If you really want them to, making decision more effectively, more timely, I think the aggregate data based on individual data can inform them to have more effective decision making. And the last thing for the data, if you have the good indicator that relevant to social and health outcomes, risk factors. If you know risk factor, you have indicators, of course, you know before they are having problems, right? What we are looking for the research program. Of course, HSRI do not want to see the one-off project. I mean that if you come with the proposal doing 1 year and you finish it up, you send me the report, and that's it. You jump to other issues. I don't want to see that. I need to see a more years research programs, because with this issue, the aging society, what we are tackling is not a short-lived project. It's a longer one, right? We also need the multi-level platform. When I say multi-level research program, it means that it could be the research program at national level, regional level, and local level, right? This is quite messy. Anybody, Thai researcher, can understand that, because you have to do a bit of the research on this before you proposing your proposal to any granting agency. I heard Dr. Somsak this morning. He said about the silo implementation program in Thailand. This also happened in Thailand for the research ecology, research system ecology. Healthcare system research institute, per se, the name already said that we focus on health policy and system research. But for the aging society research, we need both social and health research programs, right? And therefore, what we need to, how we can have the joint research between social and health research program. I think this year we've already discussed with the National Research Council to have the more target research program on aging society, part of which is the health research program. and we're going to launch the joint research program together, right? And the backbone of doing research is not doing research per se. We need the national strategy or even the local or even regional research strategy, not research, national, implementation strategy to be a backbone and the research program running around these strategies. Otherwise, we cannot translate the research results into the system and policy. And well, of course, we need the evidence that can be translated. Therefore, I think it is believed that research program must be focused on the local areas, and part of which is to increase the local capacity as well. Right. A call to rethink research funding. When I say that, how are we going to have the more transformative research strategy? It's sort of, we need the platform for change. So the thing is, the platform must have to promote the translation as well. We need a better coordination between funding agency, between policymakers, and also the non-government organizations, the civil servants. And we have to dedicate ourselves not just being a research grantors, but also to be a system builder. Last one, my key message. If we want to have the more effective research strategies, we need to be more forward-looking, asking any questions, research issues, what you're going to yield or the end result, right? And the end result or the end product must be translated into the system. If we think about the life course action, put it in your conceptual framework and do it at the groundwork, and don't forget what strategy or national strategy tell you. Don't deviate from the national strategy, because if you deviate from the national strategy, it's quite little chance to translate your research output to the implementation or even the policy. Thank you very much. Happy to share with you.
Thank you very much, Dr. Tere. So Dr. Tere give us the secret to have successful research proposal. No? So we have to consider the national strategy to develop research question and turn to be research proposal. And we're going to have the evidence base to develop our policy. Thank you very much. Next, we move to Ms. Pim Siri. She is going to give a presentation about public-private population engagement to improve older person health outcome in Thailand. Ms. Pim Siri Pubantat, she is a senior consultant on the social inclusion technical team at Kinan Foundation Asia. Her work focus on the women empowerment, youth development, gender equality, and healthcare. She currently leads the project that promotes skin health awareness and expand the access to dermatological care for underserved community and older adults in Bangkok. Please, Ms. Pim Siri.
Okay. Thank you for introducing me. Actually, I don't have any much of the data or the presentation slide to show you, but I would like to share the experience working in Kinan, how Kinan as a non-profit organization working with the private sector, public sector, and population like the community directly. Okay. Before that, I would like to give a view of the Kinan works. Actually, in Kinan, I think we work similar like the archive. I think we are like connectors. We are the bridging like private sector, public sector, and community to working together and filling the gaps, some gap that policy or maybe some kind of the work that cannot reach out directly to the community. So we fill those kind of the gap. In Kinan, we focus on like 3 thematic areas. The first one, we focus on the educational. Second one, economic development. And the last one is my team with the social inclusion. We try to promote the gender equalities, youth development, women empowerment, and also inclusive health and well-being. And we're also working closely with the senior society as a cost-cutting areas. So, yeah. How can I get that? Yeah. We working across like Thailand, South Asia, to develop the um, population with the people with the knowledge, technology, and skill for the better life. Actually, Kinan we located in Bangkok, Pattani, and also in Hanoi, Vietnam as well. So our project quite variety and kind of cover to any like social issue as well. Okay, talking about the working with the senior society, I would like to share some of the experience at working in like mainly like three project areas to see like what is the best practice or the challenge that we're facing currently working with them. The first project that I like to sharing is the project to promote skin health care to the underserved communities. We start the project as of the next research. Actually, we do the research first. That we found out like in Thailand we have like the shortage number of dermatologists to meet like the needs of the Thailand population. So we try to work with the private sector and the public sector to find out like and identify the needs of the communities. We start the project with the conduct the needs assessment. We engage with the local like healthcare centers. We engage with the community health volunteers and representative from BMA or Bangkok Metropolitan Administrative to identify the needs and the challenge that we're facing in terms of the skin health situation across Bangkok. So when we found like in Bangkok, we have like 69 healthcare centers, but not all of the healthcare center they have the dermatologist. So when the community members they have the skin disease, they cannot go to the healthcare center. They have to go to another hospital that might be far from their communities. They're gonna take time, take more money. So most of them especially in the underserved community. They work as the freelancer. If we take a leave, just only one day, they're gonna lose the income. So they decide not to go to see the doctor because if they have like the skin health disease or skin health issue, they try to skip and just go to work. What we found like there's the consequence of these two situations. The first one, just have the patient some skin disease they can get healed like by themselves, but some if they don't cannot go to see the doctors, the disease getting worse. So we like talking to the dermatologist and the skin health expert. Actually, the project funded by like Seraphy, I would say. They provide like the knowledge and consultation with the dermatologist. So we conduct the skin mobile health checkup and with the collaboration with the BMA mobile health checkup. So we have the dermatologist just right in front of the community doors. So the community members in the underserved community in Bangkok first, they can go to see the dermatologist without going to the hospital and did not take that much time because we conduct the event quite early. So they may take time before they go to work, like 1 or 2 hours, just to meet with the dermatologist first, and then they can go to work. That can save time and save cost of living for them. Besides that, we are also working with the community health volunteers. As we see them and value them as a frontline volunteers, they have a good relationship in the community. They can reach to every door of the community members. So we train like 360 with their health volunteers to have at least the dermatological care knowledge. So now they can, observe and can tell what the level of skin disease the the patient need to go to the doctor or not. And they also writing the refer letter for them, and then they can go to the healthcare centers, or they will send them to go to the hospital to have which have the dermatologist there. Here's the first project, and what we learned from this, again, working with the community health volunteers, as you may observe, most of them, they are the senior people, they are the older persons, but they are still working actively and work like entirely want to go to the community to resolve, to address the issue in their communities. They really help us to reach out to the community members who get the skin disease, and then they can provide like a primary knowledge about skin health routine, something like that. For one case that I would like to share, many of the community members, they always have like the misunderstanding about how to do like the treatment for skin disease. Some, when they get like bruise or any skin burn by the hot water, they still use the toothpaste. We found a lot from the project when we do the outreach activity. So equip the health volunteers with the accurate knowledge. They can, disseminate like the accurate knowledge to the community directly, because they live like among each others. They can just like knock the door. Sometimes they just walk around and then they can have a chat. They can talk. They can tell accurate knowledge to their neighborhoods as well. That's the very first project. And the second project that I like to sharing is the project that we empowering community enterprise. Actually, we conduct in the Chiang Khong in Chiang Rai province. From this community enterprise project, we found like almost like half of the community enterprise, they are the senior people. They are gathering themselves and split a community enterprise to generate income in the community. And what we learned from this, the community enterprise is not only generate income for their daily life to spend time together, but this kind of the group allow them a space to sharing, to networking with their friends at the same age, because most of their grandchildren, they left to work in the town. So in the rural area, at the community up there, most of them, they are the senior that working together, and it's a bit like build the community enterprise. And I have talked to some of them like why are they still like keeping doing this? They told me like it's the only platform on only the group that they can have opportunity to meeting with their friends at the same age, and the opportunity for them to still working. They have the potential to working. They have the wisdom. They have their still like the power, still working and making some products. Some products they cannot find from other district or province, only have like in Chiang Khong. It's a very unique style, like the lantern or the fabric. That showing us like the elderly people, they still have potential, and building and supporting the community enterprise also like a platform for them to at least they still have something to sharing with their friends. And it's good not only by physical health, but it also good for their mental health, because they have some space to talking with their friends, to have space like they're so proud when they're making some product and can be sold. But this kind of community enterprise also facing some challenges. Maybe we can work with some our future partner here. The challenge that we found, like, most of them, like most of the community enterprise don't have the new generation to involve with that. They lack of the knowledge in the technologies, online marketing. So as now in Kinan, we try to collaborative working with the university like Mephalong University in Chiang Rai to at least have the professor and bring some student for like connecting them together and teaching how to do like maybe online marketing, how to use technology, and as well as how to do like um, digital literacy, because it's easy for them to get like fraud and scam online, right? Yeah, and this kind of the challenge, and I also see like some opportunity as well from this kind of the elderly people who working in the community enterprise. And last one that I like to sharing is the project that we work to have. It's called like Smart Family Life Planning in Action. This project we focusing on provide and equip the knowledge and some skill with those not only for elder person, but start from the working age in preparing themselves for to have like the individual plan or the retirement plan, and to have like the smart like planning plan. We focus not only for the um what to say, not only for the retirement phase, but before we get the retirement, you have they have to think about the financial literacy, digital literacies, some part of the 21st century skills, so they can have like the resilience and readiness and can be adapt to any change that came in nowadays, because technology changes rapidly, like so fast. So they're gonna have this kind of perspective, and they can have like the perspective of life cost learning, so they can like at least have a plan for their future. Either we will have the slogan, either they want to be like a single person or they want to have the family. You have to think ahead, think about how to planning the family, like, or the retirement plans as well. And yes, last but not least, from the experience that I have working in so many projects, I would say like even in Kinan, we are the connector, so we cannot working alone. We try to bridging is partners, either from the government sectors, private sectors. We also work closely with the communities, local authorities to ensure like the program or the project that we implement from paper to practice is the effective to those beneficiary that we working, and to ensure like the plan that we have set, at least they achieve, or maybe we have to have like adaptative to see if our beneficiaries is does not agree with the paper that we like signing. We have to adapt, we have to adjust to respond to their needs. That is what the Keenan working. Yes, thank you.
Thank you very much, Ms. Pim Siri. So we are impressed by a lot of projects have done by Keenan Foundation, especially for the dermatologist and beauty community enterprise. So this project will help women to gain a lot of confidence to meet people in our community when we are getting older. So let's move to the last person, ค่ะอาจารย์ Dr. Pusit Prakong Sai, he will give a presentation towards a national strategy for health and long-term care in older age. Dr. Pusit has 10 years of field experience in public health and healthcare management in 3 district hospitals in rural area in Thailand between 1988 to 1988 to 1998. He also served as a medical lecturer at the Department of Community Medicine, Faculty of Medicine at Ramatibadi Hospital. And he also served as the Secretary General of Foundation of Thai Gerontology Research and Development Institute, or TGRI, and also the Executive Secretary of the country's Cooperation Mechanism, CCM, Office of Thailand. Please, Dr. proceed.
Thank you very much, Kap. Good afternoon, everyone. First of all, I would like to thank the College of Population Study, Chulalongkorn University, and the organizing committee for inviting me to share these topics on the national strategies for health and long-term care for older persons in Thailand. I would like to start with this one. This is perhaps the graphic that we already have seen about the trend of the population aging in Thailand from 2010 to 2040. And Thailand became a complete age society since 2023, since when it's 14 million of the older persons become the 20% of the total population in the 2023. And one thing that I would like to remind you that in the next 15 years, we will have the population around 60 million. The population will decrease to be 60 million in 2042. And the number of the older persons in 2042 will nearly double from the 12.5 million in 2022 to be almost 19 million of the older persons, which account for the 31.4% of the total population. It means that the next 15 years will become the super age society like Japan and many developed countries in the next 15 years. And from this awareness and our recognition on the complete age society, and will become the super age society in the next 15 or 20 years from now on. We have developed a strategy to tackle with aging and complete age society and super age society using the we call this is a tri-power strategies, which means that we call it in Thai as a triangle that moves the mountain, which means that we try to coordinate with three powers to tackle with many challenging issues or perhaps the challenging situation, which means that we will comprise the first power on the knowledge power or research power. And the second power is on the policy and advocacy and law enforcement power. And the third one, this is the people power or social mobilization. So this is a strategy that we try to coordinate and incorporate with three powers to mobilize power of the country to tackle with aging society situation in the next 15 and 20 years. And this is perhaps I try to draw perhaps a time series of the long-term care policy development in Thailand, starting from the 2002 when we start the second national plan. Second national plan on elderly from the 2000 to 2021. This is the 20 years national plan on the elderly in Thailand. And we start the Elderly Act in 2003 as the Elderly Act. And we developed the cooperation with the JICA program on the CTOP, yes, in 2008 that Professor has already mentioned about the CTOP project in 2008. And since then, we developed many projects with the JICA program and learn from our Japanese colleagues about how we can arrange our system to tackle with the aging population. And we think perhaps the Japanese college also learn from us as well, because we focus on the community-based intervention, which is different from the Japanese college, because they always focus on the institutional base of the long-term care project. And this is the one that we start from the CTOP project in 2008. We start the LTOP project in 2013 with the development of the Tambon long-term care as a Ministry of Public Health indicator. And in 2013, we also have the long-term care resolution in the National Health Assembly as well, in Thailand as well. So from this, you can see that we try to incorporate or integrate perhaps the long-term care policy and perhaps the aging population policy into the different platform of the national health strategy and perhaps the national development strategies. And in 2017, the military government, they developed the 20 years national plans, and we start in 2017 as well. We start the 12 national economic and social development plan, which comprise the issues of the aging society and how we can implement the policy on the long-term care and perhaps the aging care of the national plan and strategies of the countries as well. I think that we can summarize the second national plan and strategies on Thai elderly as in these figures, that we not just focus on the healthcare system or perhaps the health sector reform of universal coverage for the older persons only, but we also focus on the other social determinant of health for the aging population, such as the social pension system, public pension system reform. And we also have the program to reform the social service care and try to provide the work opportunity and employment for the elderly. This is because many of the older persons in Thailand, they are become sick and become a poor population. Many of them are below the poverty line, live in the below the poverty line. And there are other dimensions that we try to implement into the national plan and strategies for Thai elderly is on the aging in place policy or age-friendly environment. And we try to introduce the digital literacy and health literacy for Thai elderly, and try to promote and support the local government to provide community-based service care and promote the research institute to conduct research related to social welfare for the elder persons. This is the component or dimensions that we try to implement in the elderly care policy in Thailand as well. From this, we can say that in 2024, we can summarize the Thailand's long-term care policy development as a policy that we try to focus on the addressing the challenge of the aging population by the expanding community-based care and improving residential facilities and exploring the potential of implement or introduce the long-term care insurance in our countries, while we try to adapt the unique cultural and social context of the country. By the expansion of the community-based long-term care, we we try to promote and implement the long-term care program through under the National Health Security Office program or NHSO program. This is the one that I will try to explain in detail about the long-term care program under the National Health Security Office. And we also support provide financial support from the government as the old age allowance for all the older persons, Thai older persons. And we try to provide caregiver support to the bedridden and homebound older persons, and try to promote the multi-sectoral and multiple stakeholder engagement for the long-term care policy in our country. So this is the one that I would like to highlight in my presentation. Is on the strategic plan for implementing the system of long-term care for the elderly people under the National Health Security Office or NHSO of Thailand. We use this policy because we start a benefit package for the older persons in Thailand by using the long-term care system under the National Health Security Office since perhaps 2006 or 2007. And by this strategy, we used perhaps 6 strategies to implement the long-term care policy under the National Health Security Office, starting from the screening of the elderly to build the database for the senior citizens in the community. This is the first strategies. And then we try to build up the capacity of the community to provide prevention services and elderly care and rehabilitation for the elderly in the community. And the third strategy is to develop the physical support system and appropriate benefit package for the older persons. And the fourth strategy is to develop the capacity of a human resource for elderly people. And the fifth strategy is try to use the knowledge management and monitoring and evaluation. And the last one is on the laws and regulation and management system to support the long-term care system under the National Health Security Office of Thailand. And by this, we can categorize the long-term care system and services according to the level of the care and perhaps the services provided by the different level of the long-term care system in our country. Starting from the elderly persons, we use the dependent, family department and community department to provide services. And at the family level or household level, we have a family volunteer or FV. And at the community level, for example, like this, we have the multi-purpose quality of life center and rehabilitation center. And we also employ the health volunteer and elderly care volunteer and physiotherapists to provide services at the community level. For local administration, we provide a nursing home for the village providers and nurses, caregivers, care manager, and family care team from the local administration. And at the provincial level, we support the monitoring and evaluation and provide the standard control and quality control of services at the provincial level as well. So this is the level of the long-term care that and different key stakeholders that it get involved with the long-term care system in Thailand. And we also coordinate with the NGO and CSO to provide services according to Dr. Keng Pong and from Kinan Foundation that they already present to us. And this is the steps in the implementation. I don't want to go into the detail, but just try to share with you that we provide perhaps try to provide support to the local administration of organization or LAO or local government in Thailand by providing payment to the local health security fund, 5,000 baht per person per year through the National Health Security Office. And we also provide financial support to the service facility at a lump sum basis, around 100,000 Thai baht per services facilities. And this is the way that we try to organize and support the long-term care system through the National Health Security Office. And in the process of the budget allocation by the National Health Security Office, as I said earlier, that we provide financial support to the local administration organization and contracted unit of primary care or CAPS. This is the contracting unit that we contract this organization to provide services and support for the care manager and caregiver to take care and look after for the dependent elderly. There's around one care manager to 5 to 10 caregivers in the community. This will take care around 35 to 40 dependent elderly for as a one family care volunteer per household. So this is the structure that we organize and arrange for the long-term care system under the National Health Security Office. And this is the key challenge that we still have the problems of the long-term care system that even though we try to introduce and implement the long-term care system at the community level through the National Health Security Office, we still have the problem of the lack of commitment from some local government and local administration. And underpaid caregiver, underpaid care manager still is the problem and challenge for introducing, implementing the long-term care system under the National Health Security Office as well. So this is another issue that we will have a lot of increasing budget for the older persons from the 2024 to 2040s. And this is the next step that I would like to share with you, that in the future, we try to scale up the long-term care system in Bangkok and major cities and rural regions as well. And we also try to promote the aging in place policy and strategies and strengthen the community level and residential care facilities. And we aim to prepare for age-related demographic shifts across cohorts and foster multi-sectoral collaboration for sustainable long-term care system in our country as well. Thank you very much.
Thank you very much, Dr. Pusit. We have learned a lot about history of long-term care implemented in Thailand. So I think the time's up, so we don't allow to have question and answer. So you may keep the question and consult to each of the panelists later. Thank you. So give a big hand to our panelists, please. Thank you. Thank you.
Yes, and also a big hand to our moderator, Associate Professor Dr. Chongjit Ritthirong from Institute for Population and Social Research, Mahidol University. Thank you very much. So we're going to moving next to this next session, which is the working group. May I invite, I'm going to give the microphone to Mr. Sena Aji Prasadyo from ASEAN Center for Active Aging and Innovation, or ACAI, to be the moderator for the working group. The floor is yours.
Thank you very much, everyone. I know that is very tired and I saw many people are yawning and sleeping. So I would like to invite all of you to participate on the exercise session, dance together with me. So wake up your bodies and clear your heads before we continue for the working group discussion. So please stand up. I would like to invite my colleagues from Akai to help me for the dancing session. Okay, is everyone ready? Ready? All right.
Step by step, we rise as one. Healthy hearts, new days begun. Stronger bodies, brighter minds. Hand in hand, our future shines. Move together, stand up tall. Active living, strength for all. Move with strength, live with grace. Every age, every place. Stronger bodies, brighter minds. Hand in hand, our future shines. Move together, stand up tall. Active living, strength for all. Strength for all. We stand as one. Health and joy for everyone. Stronger bodies, brighter minds. Hand in hand, our future shines. Move together, stand up tall. Active living, strength for all. Strength for all. Each strand, we stand as one. Health and joy for everyone. Ooh, stronger bodies, brighter minds. Hand in hand, our future shines. Move together, stand up tall. Active living, strength for all. With strength, live with grace. Every place, every place, every place, every place, every place, every place. Stronger bodies, brighter minds. Hand in hand, our future shines. Move together, stand up tall. Active living, strength for all. Strength for all. Strength for all. We stand as one. Health and joy for everyone. For everyone. Everyone.
Thank you, everyone. So how do you feel? Energized? Happy? All right, okay. So we will continue for the working group discussions, just like the previous one. But if you would like to have a coffee break and get the coffee and bring it to the table, please do so. and we will continue the working group discussion. So we will have like the first group, first table and second table for the English speaking, and the third and fourth tables for the Thai speaking. Okay, let's continue for the coffee break, and then we continue for the working group discussion. Thank you.
Actually, the refreshment is going to be served all if afternoon, so please feel free to grab and come back for the working group session. สำหรับผู้เข้าร่วมทางออนไลน์นะคะไม่ต้องแบ่งกลุ่มนะคะสามารถตอบคำถามได้ผ่านทางฟอร์มที่อยู่ในแชทบ็อกซ์ได้เลยค่ะ So we will give you like 5 minutes for grabbing some coffee, refreshment, whatever you want, and some snacks, and to get back to the room so that we can work on the questions, and then so we will not delay for the further delay for the next session. So 5 minutes to bring things, or maybe you can just stay here and you can just grab some later on if you're not hungry yet. I'm sure you're still not hungry.
Chop chop, everyone. I would like to a reminder. Grab your coffee, 5 minutes, back to the tables, and let's have a working group discussion. 5 minutes, 5 minutes. We are off the schedule. All right, everyone. If you already grab your coffee, please back to your table. Choose your tables, 1, 2, 3, or 4. Okay, welcome back. So table 3, group 3 is still empty. Okay, please choose your table. We can continue the working group discussion. We're off the schedule. This one is sorry.
Is it possible to combine? Okay.
Yeah. All right. Can somebody move to group 3? We have to fill all the tables equally. Can speak in English. Kinan.
Okay.
Yeah.
Five. One, three. So this one is for Thai, right?
Yeah, both.
English and English.
Will you be inside?
Yes.
Speaking
Thai.
Oh. But you will deliver the result in English. So you can Okay. So everyone, we can start for working group discussion. There will be 4 working groups for, excuse me, who will be the facilitator?
Oh.
And please decide who's getting the questions and note taking and then present for the result.
Facilitator is assigned.
Yeah. But I don't know where are they? So it should be, oh, yeah, all right. Okay. Thank you. So you will address question number 1.
Question, this one?
Yeah. All right. Okay.
Option two.
Presenter. Yeah. Presenter.
In group 3 and 4, we merge.
You merged
Yeah.
and you addressed questions.
Yeah.
All right. Okay. Okay. Group 3 and 4 decided to merge. Please address 2 questions. Questions number 3 and 4. All right. Okay. So we have only 3 groups. Yeah. We only have 3 groups. Table 1 will answer question number 1. All right. You can start. Table 2 question number 2 for what are effective models or partnerships. So we talk about health and care systems. All right. And table 4 will address questions 3 and 4. All right. I will give you 15 minutes to discuss. 15 minutes of discussion. And please decide who will present for your discussion results. Thank you very much. All right, everyone, I will give 5 minutes more, additional 5 minutes, because it's a very good discussion. I hope we can finish by 4:15. Thank you. Three minutes left, and please decide who's going to present for your group. 1 minute left. Okay, group 1 and group 2, they are ready to present. What about group 3 and 4? Ready? Who's gonna start to present? Can we start from group 3 and 4 because they covered 2 questions? Okay. ขอบคุณครับ Okay, group 1, group 2. You ready? All right, okay. We're gonna hear from group 3 and 4 because they're also ready and cover 2 questions. So maybe let's listen to them.
Ờ, anh nàyนะของเราเริ่มตรงไหนนะเริ่มจากตรงนี้คำถามเราก็เป็นทางนะคะโอเค policy ก็จะเป็นตัวนี้policy ถ้าพี่ไหนถ้าพี่ไม่เข้าใจตรงไหนบอกด้วยนะโอเคค่ะ so our group we discussed two questions. The first one is relating to being inclusive, no? Like being more inclusive, and what kind of policy that should be, beneficent for inclusiveness for especially older people with multi-vulnerable or like this intersection of different vulnerability. And so the first one that we discuss a lot is about discrimination, age discrimination. Actually, the age discrimination or discrimination dimension included in different law, but there is no master or the umbrella law regarding discrimination, and we think that it's a limit the practice, no, in terms of enforcing other law. So that would be helpful if there is a discrimination law, and this highlighted by the National Human Rights Committee. And the second one, again, this is related to discrimination relating to employment, because in Thailand, in the constitution, discrimination is prohibited, but in practice, something that is socially acceptable. No, we see it often, even now, if you look at the classification or announcement for employment, hiring people, you will see that they say not over this, this upper age limit. I think we accepted underage, because to protect the minor, but upper age limit 35, 40 is already not possible. And but in terms of again, this employment, there is some law, not some, there is some disagreement or kind of not sure about the incentive, for people with disability. If they are older and they are disabled, they are covered by the law that the company with more than from 100 to higher number of employees, they have to hire at least one person with disability. But there is some guideline. It's not clear here, but we have to check on this, that they say this doesn't cover older people. It's not age, the category is not including age. So this something could be helpful, but probably need to further debate about it, but there's some suggestion from this group. And the other point about promoting decent workplace. So we talk about, workplace arrangement that flexible for older people. I think in this case, not older people, but also family member, if it's flexible, we have maternity leave, when we for childbirth, but probably we also need whatever age care leave for caregiver, because this morning we talk about family caregiver, like Vietnam saying that 96% is provided by care, and I think by family members. So that's probably the same thing here. So something to be looked at. And you might be wondering why on this employment will be related to being inclusive in terms of care provision. But we are talking the whole day doing saying that care is not, care system is interrelated to other dimension of work and employment and other dimension. So talking about employment relate, it very much related to care provision and being inclusive. So the second one, question number 4. And for question number 4, what type of data and research and indicator are most needed to inform, monitor progress, enabling environment and aging population? We don't have much time to discuss, but what we come up with is that, what is this? We try to combine okay. So this one, what we said is that, to start with, currently we have the national policy, national plan, including the national development, national long-term aging, for the national plan for older person. And these days indicator, there is time frame and for evaluation. So starting from there, and then what, and other also framework like our national plan, development and social development, the NESDB national plan, right? We are 13 on the 13 plan at the moment, right? And there are other, even like a regional one or global one, a decade of healthy aging, right? That is a starting point, from the national data set that is already available, and we review whether age care or care provision, care system is sufficiently included in those data set, whether there is sufficient indicator that it should be included. So we don't start from scratch. And by doing so, especially if it cover, if it is regional policy or plan or agreement, it help us for comparison. It help compare across the country, and that is helpful to support each other beyond our own country. That to start with. But then we also, you say something about tax. Okay, we talk about tax. I think again, we have the lady from a National Human Rights Committee, which is very helpful, because they are looking into this kind of data and information. Is that how tax is involved here? Is that actually it related to income? If we have collect data that, again, where it might be already available, but look into the income and then see whether who are, but it go back to the poverty line or the poverty rate. But using this data to also related to care provision, because if they are in poverty, it's very much likely that they don't have the family cannot provide properly care. If you're also looking at the information of the family member, kind of linking the income and tax into care provision. And I think the last one is to do with education, yes. There's 2 things. The first, Ajahn say education. You said actually on this, if you want the data or you want care inclusiveness or whatever, starting by changing people's mindset, and like we discussed this morning, they have to pay attention. They have to prioritize care provision and also understand care need and care challenges, both for the family caregiver and everybody. So starting by recognizing that is imperative for development, I think word from this conference today. And the last one really from the caregiver. You. Oh, the Ministry of Interior, yeah. Department of Local Administration, I believe, right? Any? Okay, community development, the department, and but they conduct this data is called job I don't know how to. And they, okay, the regular household data collection is very detailed. So what we are saying here is not because of maybe it's not enough information here or data, but it's not sufficiently analyzed and used. So we end up here sometimes lots of information, but it's not used properly, not used sufficiently, and just being there on the shelf. Thank you very much.
Thank you, Group 3 and Group 4. Any other questions from other group? Or we can continue for presentation? No? All right, okay. Group 2, are you ready to present? All right, okay.
Okay, yeah, I know. Time control is very important. Everyone looking for the dinner, right? Okay, so basically what we discuss is about what kind of model is good enough to support the future care system in Thailand or in other ASEAN countries. So we share a lot of case, and most important is we found that actually Japan and Thailand is very similar, like we are relying on our family base. But however, this is also could be the future problem, that how can we let our family give up their job and then cannot go back to their workforce after like 10 years, 20 years caregiving. So there will be the future issue that we have to think about. How can we make maybe our family member to have enough skills to be satisfied or be organized by the government, and maybe they can have a skilled like a registered caregiver, and then to give the care in their family and also get a fund or salary from the other system or government to be paid. It means that when they are giving the care in their family, they can also receive the fund, I mean the money. So another case that I also share in the group is about the case from the US called PACE, PACE. This is called a kind of inclusive care systems that they organized about 12 different roles and functions in the community to provide for the care for those who need the home level care, so they can walk a little bit or to be delivered by the car into the care center and then to receive different care in the one facility. And another case is in Germany, that the government directly talked to the 4 different foundations or NGO to let them to organize all the care from the government fund. So it's more easy to control and also to be easy to give the care for all the people who are living in the community. That's all. Thank you.
Thank you very much. Group 1, please.
All right, good afternoon. Our team is tasked to answer the question, how can the care system be designed to improve and ensure universal and equitable access to primary long-term mental health for older people, particularly on underserved areas? Generally, the discussion is actually, enriched by the different participants, particularly sharing from Thailand and also from Japan. Okay, but basically in terms of the result, we can actually categorize it into 2. Mainly, the first team has something to do with more structural and on a higher level, but the other one is more of operational. In terms of structural, number 1 is that we want to redefine the scope of the care system. Like what is care? What is the package? What are the services included? will it be like will it be what is the formal and informal? What are the packages involved when we talk about, the care system? There's also a discussion about standardization in terms of reducing inequities or inequality, particularly among the rural and urban areas. Mentioning that some of the areas might not have, the same resources as the other areas. And also, there's also a talk about comprehensive system beyond health. Would like to see the health system is something that is limited to health, but there's also some aspects that needs to that needs to take into account as well that might affect health. For instance, educational, socioeconomic status, particularly of the people in a certain community. That's why we are actually discussing about strengthening what we have, the current social security um, system that we have right now, in terms of making sure that the system works in reducing inequalities by providing public long-term care, particularly on the underserved communities. So much for the structural part. Would like to tackle on the more operational, in terms of how are we going to do, the community intervention. Majority actually um, like agreed that it has to be bottoms up approach. Like the community, especially on the experience of Japan, like the community in itself has to lead, like the planning in terms of how do they want their system, um, or the interventions to be implemented. That ensures that they should be like a capacity building, and we should build community leaders in which the community itself plan, for themselves, which is more efficient and effective in the long run, because they don't need other people to work for you, but the community itself working for the people. In terms of there's also a highlight of community-based care system, which is, we believe, a bit efficient. But the thing is, like, one of the challenges is to provide capacity building, especially for the carer. We want to make sure that the carer itself are capacitated or knowledgeable, not in a medical way, but in a more practical, in terms of caring for their community, which is tailored or somehow suitable for the community. But we want to end the discussion by highlighting one challenges. In That would be budget or finances in terms of supporting the community-led. Considering that there is a centralization in terms of budgeting. Okay, I think one of the challenges that was, discussed or imposed, is that how can we ensure that there will be like a continuity of program, considering that, we sometimes rely on the central government in terms of program implementation. Thank you.
Okay, thank you very much. So we already we already heard from all group that, let me summarize the information that from group 3, uh, they talk about inclusive, which is the discrimination. There are no umbrella of law, very limited. They also talk about the employment, where the limited for upper age, not for the younger generation. And also incentive, there is no cover by the law, not cover for older person, and promoting decent workplace. And for the data collection, there is some of the implementation on the national policy for older persons, but also there has been some challenges on the how to use it and how to make the data to be more efficient. And from group two, sorry, for group two, discuss about the family base, that they discuss that we need to upskill and reskill for the caregivers, and considering to reply or replicate for from the inclusive care system from USA, and also some of the implementation for Germany and Japan. And also from group one is talking about structural and operational, where they mentioned that there is a need to redefine for the package and inequality for older persons, and also another factors to be considered for education and other factors like environment, to making sure that the system also work. And the operational thing is about the bottom-up approach, where the community is the owner for intervention. So the capacity building is really needed to make it sure that all the system to be more efficient. And they also talk about the needs for the funding and financing for how to make the health system to be effective and efficient. So that's all from session 4. I would like to thank you for everyone for participations.
Thank you very much. And I also would like to thank you, Mr. Sena Ajit Prasatyo from ASEAN Center for Active Aging and Innovation as well. All right, are we moving to the next sessions right now? Ajahn Sawangka, are you ready? Ajahn Sawangka. So the next session is the thematic discussion 3, creating enabling environments and fostering innovations through inclusive care system for sustainable and effective care. So this is the last session for us today. And we have an honor from Mr. Sawang Kanta, Director of Foundation for Older Persons Development or FORDEP. I think everyone knows him, right? Yes, see? I don't need to introduce him anymore, so just put your hand together and give him a big for Mr. สว่างแก้วคันชาค่ะขอเรียนเชิญค่ะอาจารย์สว่างค่ะ and I'm going to hand over my microphone to him right now. You will be the last moderator of today for this panel discussions. Okay, อาจารย์สว่าง if you are ready, the floor is yours.
Good evening. I would say good evening. Yes. It's my privilege to be here on the stage. And so I would like to, for the time, I think we are about 80 minutes behind the schedule. And so in this session, we will discuss about the creating enabling environments and fostering innovation through inclusive care system for sustainable and effective care. So we have 4 delegates to speak about this. So first one, I would like to invite Professor Dr. Takio Okawa. Please. Professor Okawa is the chair of Fukuoka Council for Design Society in Aging in Asia, and he has lots of experience and many titles, positions. Okay, you can introduce yourself later on before your presentation, if you like. Okay, the next speaker, I would like to invite Dr. Gun. Dr. Gun Go, yes, from ASEM Global Aging Center. And the next one is Dr. Marita Linia, sorry. From College of the Elderly, from ASEAN Center for Active Aging and Innovation, or ACAI. And the fourth, last but not least, Dr. Han Xiaoting. From College of Elderly Welfare, China Civil Affairs University from China. Okay, so at the time constraint here, so we have 45 minutes, but we have 4 people to speak. So as I would say that each of us here, 10 minutes, the longest. You can 8 or 10, 8 to 10, okay? First, I would like to invite Dr. Okawa. If you would like to introduce yourself, okay, 1 minute for that. Thank you.
Thank you very much, your kindly introduction for me. And I am originally a sociologist and especially focus on the social gerontology. And many times I came here and making some joint project. One good project is JICA supported me. It's a preventions for the long-term care for the Bangkok metropolitan administrations. And today, I'll I'll say the designing societies for aging Asians in innovation collaborations and inclusive futures. Then I'll make this Japanese experience to be learned for or think about the next your society. This is a Japanese population transitions. Yeah. Maybe in near futures, every country following to Japanese way. Yeah. This is a very, very severe problems. Yeah. Not so happy situation. But we have a mankind to think about a resilience way. How to make a resilience strategies for this severe society. Okay, this is a, you see the demographer. There are a lot of the demographers and the demographic transition models. Every country almost the same transitions and many deaths and many birth rates society to many few deaths and few children society. But after that, can you see here? Oh no. Here. Nowadays, Japanese society is many deaths and few children. Then population is decreasing. This is a very severe problems for Japan. Then trend of the dependency ratio. This is a, can you see? This red line is a children dependency ratio. But it's a decreasing. Yeah. No more all adults needs not to support children no more demographically. Yeah. But they should support older person. This is a green way. Too severe burden. This is a demographer's thing. Yeah. But if these kind of demographic backgrounds, we cannot complain it. We should learn much more. This is an old age dependency ratio in Japan. At 1970, 10 young generations support one older person. 2000, 5 persons support one older persons. And now, 2% only support one older person. How to survive in this society? And the same ratio, 10% support all, 5 older person. It's the same. But if we encounter with this kind of a severe country, if older person change to supporting resources, and also we inviting foreign workers, and also we promote innovation, technological labor productivity enhancement, and support new intergenerational relationships, and making an older person preventive health for older persons. These kind of total measures is needed now. And this is our effort. How to get it? This is the Japanese society's agenda. Then propositions for inclusive sustainable society. One, mindset of human being from user consumer to integrated image prosumer. I am a producer and consumer. This kind of a human image is very important. All the persons are not only service receivers, but also service providers. Technical and human supports are enabling for vulnerable persons to achieve their normal life and work. Those who are originated on different way of life may contribute to the hosted country. Inclusive and collaborative communities should be organized. This is the target. Improvement of the infrastructure for universal long-term care for older persons in Japan. This is almost already you know, and but it's need some step by step progress you need. 1989, the MHW and the Ministry of Finance and the Ministry of Home Affairs agreed to formulate the 10 years strategies for the promotion of health and welfare for the elderly. This is the infrastructures enhancement. And also the plans to invest more than 6 trillion yen over 10 years to promote in-home welfare measures through the development of the long-term care facilities for the elderly, home helpers, day services, and short stay facilities. This kind of infrastructure is improved. And this kind of we say the gold plan is a very important to establish the comprehensive care systems in society. And also, decentralization is one very important factor. The authority of the 8 laws on social welfare was shifted to municipalities with the division. The municipalities shall formulate their health and welfare plan for the elderly, and the prefecture governments and the national government will support it. This kind of a decentralization is a Japanese way. Therefore, preparing a long-term care insurance system, national governments will secure financial resources through the consumption tax hike and will adopt social insurance systems and the municipalities becomes long-term care insurers. Let's see. This is a Japanese long-term care insurance financial system. And you can see this one. Left side is a citizen. Yeah. And you see that right side, general tax, the half and half. And also, this citizens premium is not only the 40 years old to 64 years old generation, but also older person in Japan take care of their own premium, because Japanese older person have a universal systems under the universal system. They have a normally pension systems. They have a pension money. Then they take care this kind of premium. Also, after 2005, the Community General Support Center, sometimes we say Community Comprehensive Support Center. This is a public health nurse, the social workers, and chief care manager engaged in the job. And every secondary school district has a community generals, community comprehensive support center. This center take care the all of the cases and provide necessary assistance for the maintenance of the physical and the mental health of residents and the stabilities of their lives. In Japan, 5,431 places they have. Also, comprehensive consultation support project, preventive care management, and advocacy project, comprehensive and continuous care management support project, and community care conferences. This kind of not only the healthcare, but also the social care service is integrated under this center. This is a same chat overseas. And now, inclusive community organizations making some new programs. Not only the specified target, but also we need to integrated comprehensive support systems for the many different targets: children, poverty, the frail older persons, and people with disability. This person should be integrated, and community inclusiveness is a very important measures target now. And then we say social integration or social inclusion. This is our purpose to enhance. Through the multi-layered support system, every municipality will provide support to residents and their household who face issues in their daily lives and promote community welfare by residents themselves, etc. Just every person living in their own home and getting support, not only the medical care professional or social care professional, but also the neighborhoods and the neighbors, stores, many postmen, meta readers, delivery men, they take care for the residents. This kind of a system is very important. then we think about this kind of a system is inclusive community. Then I summarize the Japanese experience. At first, a pre-aging society, at that time, we were making some new programs. Older persons should be supporters and workers. How to secure these kind of chances. And Social Welfare Act focus on the elderly's human rights. Aging society phase, where shift the target, basic act of measures for an aging society. And it's a comprehensive measures, not only the healthcare or social care, but also the land use or urban planning and education. Yeah. And also act on the promotion, research, developments, and the disseminations of the social welfare. This is welfare equipment. There are a lot of the good facilities, welfare equipments, but almost of the people don't know. It needs some kind of dissemination centers. Every person come to the centers and can learn the new technologies and install this new technology for their caring life. Oh. Excuse me. Okay, back. And the aged society phase, this kind of elder abuse prevention, act on the protection of the personal information, act of the securement of the stable supply of elderly person housing, and act on the guardianship legislation, etc. This kind of another phase is started. And also now, act on the promotions of the comprehensive securing of medical and long-term care in local communities, and the Social Welfare Act amended, and acts on the comprehensive and integrated promotions of policies for the realizations of a universal society. 2018, it's enacted. Then next stage, the basic act of the dementia to promote an inclusive society. Just last year's enacted. This is a Japanese experience. Maybe almost a country follow to the Japanese way, but Japanese challenge is not perfect one. Please refer to this Japanese experience for your differences. You must learn Japanese way and change based on your situation. This is my message. Thank you very much.
Thank you very much, Professor Okawa. One thing that I want to highlight is he said that older people is not only the receivers, but also the contributor to society. That is good, and is in line with the UN International Day of Older Person for this year. That is order, not over. So keep on. Thank you very much. Next, I would like to invite Dr. Gun Go from ASEAN Global Acting Center, Global Aging Center. You talk about the upholding human rights of older persons in inclusive system, regional perspective and practices. Please, Dr.
Thank you for introducing me, and thank you for inviting me to this meaningful and important events. Thank you, the Chulalongkorn University and the Department of Older Persons. Actually, I was trying to introduce about the AGSC and from before starting my presentation, but I think in the interest of time, I might have to jump into my contents. So you may refer to my presentation file through the QR code if you're interested in our organizations. And if I have some time left after my main presentation, I might have to come back to those introductions. So today I want to introduce you about one important and ambitious project of AJC that we have tried to have from year 2023. So skipping this part, and I'm going to start from here. Actually, from year 2020, AJC tried to develop a framework act, draft of the framework act on the human rights of older persons. The thing is that while I was listening, professor's presentation about Japanese experiences, I feel like, wow, the Korea is just following the steps that Japan have proceeded, and especially from the last parts of presentation, you introduced some kind of very various legislations and acts related to the human rights or rights of the older persons. And that's happening in South Korea. And after those legislation efforts, some activists, scholars, former Supreme Court judges, former minister of gender equality, they got together and they were thinking to make a framework act, kind of overarching or umbrella act that goes above those individual, scattered those legislation or act regarding the rights of older persons. So that's the start of this kind of ambitious project. So in year 2024, the English version of the Framework Act on the Human Rights of Older Persons was published. And this year 2005, finally, we have seen further momentum. In April, a civil society network titled the Coalition for the Enactment of the Framework Act on the Human Rights of Older Persons was launched. And in early May, the policy forum was held at the National Assembly of the Republic of Korea, bringing together lawmakers, experts, and the stakeholders to discuss the importance of enacting this legislation. These efforts reflect growing recognition, both domestically and internationally, of the need for a legal framework that guarantees the dignity and the rights of older persons in an aging society. So these days, actually, last June 2029, Korea had the new inauguration of a new president, and they are now making a key national agenda for the new administration. So we are trying to also put this agenda into that, like a key national agenda of the new administration. So then why, again, going back to this, the aging trends and demographic shifts in Korea, again, I think these graphs very much look alike like the graph that the professor previously introduced. This orange line is the composition ratio of the population aged 65 years or older compared to total population. So Korea already actually became a super aged society just last December 2024. So this trend will continue to accelerate, and the proportion of the older persons is expected to exceed 30% by 2036 and 40% even by 2050. And by 2060, the older population will be twice as large as the younger population, significantly altering the structure of society. So as a result, Korea's population pyramid is undergoing a dramatic transformation, shifting toward an inverted triangle, like a triangle which like have a larger parts up and the smaller part or narrower part and the down. So there where the base of younger people become smaller and the top of the older age groups expands. So as you can see in the graph, the number and the proportion of older people have been rising steadily and are projected to increase sharply in the coming decades. So this demographic shift presents both challenges and opportunities that we must be prepared to address. Actually, for your information, Korea entered aging society in year 2000. In year 2017, they entered the aged society. But just in 7 years, like in year 2024, they entered the super aged society. They have really rapid aging trends. So among these trends, I want to point out two significant phenomena. First, the rise of the single-person elderly households. I think this was also mentioned in the previous sessions. So Korea is experiencing a rapid increase in the single-person elderly households. As of 2023, 25.1% of all households were headed by someone ages 65 or older. And this figure is projected to rise significantly, reaching nearly 50% by 2050. The number of single-person elderly households is expected to grow by 134%, increasing from 2 million in 2023 to 4.7 million in 2050. And by 2050, 1 in 5 households in Korea will consist of a single older person living alone. So this trend signals major implications for social protection, healthcare, and community support systems. Secondly, Korea also faces serious challenges in ensuring income security for older persons. So year 2021, the poverty rate among people aged 65 and older was 39.3%, the highest among the OECD countries. So Korea's public pension system provides limited coverage. Only 22.3% of elderly income comes from the public pensions compared to the OECD average of 60%. So as a result, many retirees face severe economic insecurity, especially if they do not have a private savings or family supports. So these trends highlight the urgent need to strengthen social safety nets and rethinking income support systems for Korea's aging population. Okay, I'm gonna skip this part. So again, why we need a framework act of human rights of older persons in South Korea? Because there is a legal and institutional gaps. While Korean constitution guarantees the dignity, equality, and the humane life of all citizens, there are still critical legal and institutional gaps when it comes to older persons. So current law largely rely on the principle of self-responsibility, placing the burden of care on individuals and families. The state plays just only a limited role and selective role in providing welfare for older persons. As a result, the systemic discrimination and long-term inequalities continue to affect many older adults. So these gaps make it difficult to ensure the full protection of human rights in older age. So why a framework act is needed? Because the Framework Act would address these gaps and it can provide a legal foundation for rights-based approach to aging society, aging policy, and support for comprehensive reform in areas such as the social security, employment, and welfare. And also it provides alignment with the international standards, including UN principles and global norms on the rights of older persons. And most importantly, it would shift the focus from selective welfare to universal rights protection. So in short, a framework act is essential for Korea to meet the needs of its rapidly aging population while upholding the dignity and the rights of all older persons. So let me see. Okay. So if we are interested in the common components or the like basic areas of this like draft act, you can visit our website, AGC's website, and you can find those like the files on the website, or you can just email me and I can send it to you. So finally, this enactment of the Framework Act on the Human Rights of Older Persons marks a societal commitment by the state, communities, and the citizens to ensure that the growing old is no longer perceived as a personal or social misfortune, but rather a phase of life where the dignity, value, and happiness of older persons as human beings are fully recognized and realized. And thank you for your attention. Thank you.
Thank you very much. Good timing. And that's good that many countries present the very good side of the older people. But human rights of older people is very significant because the poorest poor old people are neglected. And activity that many countries show that the older people enjoy the activities. But how about the poor old people? They could not join, or the poor because of maybe ill health or poverty. So this is like we have to include everyone. And back to your like the active aging should take care of the poor or ill health older people in society, in their community. Thank you very much. Next, I would like to invite Dr. Marita Linnea from ASEAN Center for Aging, for Active Aging and Innovation to talk about the Happy Retirement Project, co-creating innovation and research for quality aging. Thank you.
Good afternoon, everyone. Do we need more exercise? Okay, so after going to Japan and Korea, I think we need to back to ASEAN right now. So I'm Marita from ASEAN Center for Active Aging and Innovation. So it's a bit different from our executive director presentation in the morning. So I will focus on the research in this moment. So as discussed in the morning that we are still a baby organization in ASEAN. So we run this organization is less than 1 year and we need more collaborations. And also I need to collaborate with the role of the ACAI. So the first one, ACAI as the connector. So we link the donor stakeholders, also government and private sectors and NGO to delivers that we have done, that we have to deliver this to the implementing agency. Especially we focus on the 10 ASEAN member states. And then ACAI also play the role as the knowledge hub. And then we, as a facilitators and capacity development to serve and support the ASEAN member states. And also we play the roles as the monitors and evaluators. So we work very closely with the partners. Our partners is not only come from the ASEAN member state, they are come from the many countries over the world, but we focus to support the ASEAN member state. So this is the framework of ACAI that we play a role as the connector at this moment. So I just want to briefly explain some project related to research by ACAI and some of our stakeholders and partners. The first one is the Happy Retirement. So this is the mixed method survey. Actually, we work together with the HITEP and also the TDER from Thailand. And at this moment, we start the project in Thailand and then we'll extend to other ASEAN member states in the future. The second one is the ASEAN Active Aging Index. This is the research that we work together with the IPSS in Japan, with the Professor Hayashi. And then we also have the project with the pilot project in Asian countries. In Thailand, we are starting with the Rayong province, and then we try to make this city as a twin city as a Fukuoka. And then we have the call for research and innovation. So we serve the research from the small to up to scale grant, starting from 50,000 US dollar for the small grant, and then for the scale up, we serve up to 150,000 US dollars. It's a big opportunity for all of you to join us. Just briefly about the Happy Retirement Project. I think this is some organization has been done this project as well to measure the pre-retirement age. So we focus on the formal sectors in this moment. And in Thailand, we conduct the research in Bangkok, Chiang Mai, Khon Kaen, and Songkhla. And for this research, because this is the mixed method, we consist of the review, survey, and focus group discussion. And the information from our partners, HITEP and TDRI, they just start in Khon Kaen, and in upcoming week, they will start for the Songkhla. So this is the Asian Active Aging Index that we learned a lot from the Japan. So Japan, they established the Healthy and Active Aging Index. So this is the index that they established. You can see the sixth one is including the COVID-19. So it's established during the pandemic. And then we need to try toward the Asian Active Aging Index. We are under the process of developing this kind of research. So for the pilot project in ASEAN country that I mentioned before, we try to develop the twin city between Rayong City and Fukuoka with some 10 like a shopping list that we can provide what we can collaborate with the Fukuoka city and also Rayong city. And we also start the pilot project in Indonesia and Vietnam right now, and then still under developing that kind of city that we want to select. I think this is the most important one that I want to explain about the call for research and innovation. We are still waiting the submission up to 15 August. And then this is the scope that we plan to establish. And then we, as I said before, that we have small and scale up grant. And then up to now, we receive 8 proposals only. So there is a lot of opportunity for you to join us. And also, we need to make sure that this project will be implemented in ASEAN member state, but also we require the PI is come from the ASEAN, but for the co-partners, it can be from any country. So if you need more detailed information about the call for research, so you can scan this barcode, and then, or you can just email me. So apart from the research, ACAI also support the capacity building for ASEAN member states through the country coordinators, governing board, and also the expert group meeting. The first one is we plan to have the country coordinators workshop in Bangkok and also in Japan. And also after submission of the proposal, we plan to have the independent review panels in Brunei Darussalam in next October, and also we plan to have the expert group meeting of ACAI, and also the governing board meeting in Brunei Darussalam. So for the collaboration, as we are still in the very young organization, so we need the collaboration from the government, interregional and international organization, and also from the university and NGO and private sectors. So from the government, we propose the aligned policy and data from academia and NGO can be generate the evidence. From the private sectors can we provide the technical and scale, and from the global partners can ensure the synergy with the international goals. So ACAI facilitate the collaboration across this kind of the sectors. Okay, as the logo of ASEAN, so we dare to dream and we care to share. So please visit our website and welcome for collaboration. Thank you very much. Good afternoon.
Thank you very much. Good timing. Yes, when you talk about retirement, mostly refer to the government officials, but the people in the countryside who are the farmers or they work in private sector. So many of them never retire. I have example, both of us not retired, still working. Okay. Thank you very much. And lastly, but not least, I would like to invite Dr. Han Xiaoting from College of Elderly Welfare, China Civil Affairs University, China. She will talk about the policy in industry and educational collaboration in elderly care between China and Japan, a case study of the Sino-Japanese care policy for older persons and industry collaboration project. Please.
Thanks to Mr. Savang, my dear old friend. We met last year. Good afternoon, very honorable representative. I'm Han Xiaoting from China Civil Affairs University. It's a great pleasure for me to share the construction and practice of China's home-based elderly care service system. Thank you very much for the invitation from Ministry of Social Development and Human Security. Thanks to Chulalongkorn University sincerely also. In China, people aged 60, In China, people aged 60 and above are defined as the elderly. This is a National Report on the Development of Aging Affairs in 2024, just released by the Ministry of Civil Affairs. The report shows that by the end of 2024, the elderly population in China has exceeded 310 million, accounting for 22% of the total population. It is even close to the United States, the third most populous country in the world. It can also be seen from this chart. Thus, the number of the elderly people in China has been increasing year by year. In the past 10 years, the elderly population has risen by nearly 6 percentage points. This set of dynamic graphs shows the changes in China's total population from 1953 to 2020. In contrast to the continuous rise of the elderly population, China's total population declined in 2022 for the first time after a long period of growth. By the end of last year, the total population has been declining for 3 consecutive years. In addition to quantity, China's demographic changes are also noteworthy. With more deaths than births and fewer young people than old, China has gone from a population growth pyramid to a shrink sub-pyramid, which varies the government more than changes in the total population. China is pursuing Chinese-style modernization, which has Chinese characteristics in 5 aspects. One of them is modernization with a huge population. In modernization with a huge population, it includes a huge elderly population. In addition, China's aging also has the outstanding characteristics of rapid aging, fewer children living alone, more chronic diseases, and getting rich while getting old. All these have brought great challenges to the Chinese government's pension work. China has formed three basic pension service models, namely home care, community care, and institutional care. In terms of importance, the basic positioning is home as a foundation, community as a support, and institution as a professional support. As of 2023, there were 41,000 elderly care institutions and 363,000 various community elderly care service facilities in China. So, how many people are there in each of these three ways? In the past, the government envisioned a distribution of 1973 or 1964. As can be seen from the table, the 1973 distribute means that 90% of the elderly receive their care at home, 7% in the community, and 3% in institutions. In the morning, a scholar also talked about this. In recent years, many studies have shown that the elderly care is closer to 9901. That is to say, 99% of the elderly are cared for at home, even some severely disabled elderly people. China's elderly care service are mainly constructed according to administrative divisions. In early 2025, the government proposed to build a three-level elderly care service network at the county, township, and village levels. At the county and district levels, elderly care service guidance centers will be established to plan elderly care service resources in a coordinated manner, provide demonstration and guidance, and conduct resource allocation. At the township and street levels, regional elderly care service centers will be established to provide disability care, life care, and other services to form service hubs. At the village and community levels, the layout of elderly care service sites will be improved to meet the nearby needs through home visits and daycare. Community-level elderly care service institutions are the main providers of home-based service. Secondly, there are nursing homes. They can be based on their ability to decide whether to carry out or provide what service project home endowment. So, how to solve the dining problem of the elderly living at home? If the elderly have good physical activity, they can go to the canteen of the community service center. This picture shows a community canteen in Hangzhou City, Zhejiang Province, which I once investigated. Every day, many elderly people have meals here. In addition, there are already many socialized catering enterprises that mainly serve the elderly. For example, this photo is from the Haidin canteen in Beijing City, which is also open to everyone. If the elderly do not want to eat out or are in poor health and unable to do so, community canteens and specialized elderly catering enterprises can deliver food to them. Let's look at medical issues. Medical services are more difficult in China. There are institutional reasons here. In China, Medical treatment involves the related responsibility of 3 departments, including the civil affairs departments, the medical departments, and the medical insurance departments, which makes it difficult to coordinate. Therefore, for a relatively long period of time, the medical service in home-based service specifically referred to medical assistant service, mainly including health monitoring and accompanying them to seek medical treatment. With the increasing health needs of elderly, this problem will be more prominent. Let's talk about care service. Its main service provider are community elderly care service institutions. When the elderly have needs such as health cards and pedicures, but community service institutions cannot provide, they often link up with some socialized, specialized institutions to do it. Through door-to-door service, they provide service such as busing, health cards, grooming, and assistance with meals for the elderly living at home. For disabled elderly people who receive home-based care after a unified assessment, they can apply to the government to establish family-based elderly care beds at home. Family-based elderly care beds are established and provided by elderly care institutions that have passed the qualification review. The elderly can enjoy continuous, stable, and professional elderly care service similar to those provided by institutions at home. Regarding home-based elderly care work, the government's concerns include the following 3 aspects. First, ensure that low-income elderly people can also afford home-based care service. The main ways are subsidies and consumer vouchers. The government guides the elderly to purchase necessary service for home-based elderly care by distributing consumption vouchers. This measure initially provided subsidies for home-based elderly-friendly renovations, later evolved into subsidies for purchasing assistance devices, and now focuses on offering various service consumption subsidies to disabled elderly people. Second, deploying home care service facilities. I've talked about this before. The government is building a 3-level service network with village and community service facilities at the end. At present, there are more than 360,000 such facilities nationwide. Third, focus on the construction of talent. It has set up related applications such as elderly care service technician, elderly care work, a long-term care instructor, elderly ability assessor. On the other hand, the government developed professional education vigorously. By the end of 2024, more than 710 colleges and universities had set up nursing, elderly care service management, and other professional points. China Civil Affairs University, where I work, attaches great importance to the education of elderly talents. The university is the first undergraduate institution of higher learning in the field of civil affairs in China, offering a total of 25 undergraduate and college majors urgently needed by the society. The College of Elderly Welfare is set up with the goal of cultivating healthy elderly talents. The college offers measures such as smart health and elderly care management, nursing, and health management. Currently, there are near 1,500 students. Or if you want to know more about CCU, you can click on the About website to view it. Here is my email address. I welcome in-depth and long-term discussions and cooperation with all of you on international elderly care issues and the cultivation of elderly care talents. Thank you all sincerely for listening. Khun khun ka.
Thank you very much. So we have good idea from our speakers here, but unfortunately, we don't have time for any question or answer here. But interested in what interesting here is the care in place, which is good. But for my opinion, it's not only personal, personal, physical, or mental health, but also the sanitation, household sanitation improvement. It is very important. But if you don't improve that, it may cause your sickness. Who knows that? Okay. Thank you very much all for your time.
Thank you
Thank
very
you very
much.
much.
Sorry, I'm so sorry. Sorry. Have you finished? I'm so sorry.
No?
อาจารย์สว่างได้บ้างแล้วใช่ไหม
You have 5 minutes.
Oh, I mean, like, I'm so sorry. I just thought that you have finished. Have you? Yeah, like,
So we finish now. Yeah.
you finished, right? Okay.
Thank
okay.
you very much.
Thank you very much.
Thank you for your kind attention.
I'm so sorry because we are like very late. So next working group again, but this time we're gonna make it very quick and brief, so we have to finish by 6. The room is gonna cross. So yeah, so from 4 groups, we'll be divided into 2 groups. 1, 2 together, English speaking participant, and 3 and 4 together for Thai participants. And I'm gonna hand microphone to Ajahn Rathiya Pulaor, our dear Ajahn. So please, I'm gonna make it quick. Your turn.
Thank you so much, our beloved MC, นะคะคุณสุทธิดา นะคะ and well, I'd like to introduce myself briefly. I'm Rati Abulaor, and I'm really grateful to have all of you here. So since we have very informative sessions, and then I'm sure that all the inputs are very useful, and that's why we have very, very practical and very interesting, many interesting recommendations listed there. But at the same time, we'll need to rush in this session. I'm so sorry for this, but just to make sure that we can get all of your inputs, and all the inputs today will be compiled and become the draft recommendation for discussion tomorrow. Before and after that, we're going to have the active, the discussion on how we can enable and making sure that the recommendations are not just only just the recommendation, but how can we move forward and what to be the actionable recommendations up on our mutual inputs. So let's start here. May I, as the MC say, we're going to divide it into 2 groups. On my right-hand side would be for those who would prefer to speak English. And for the left-hand side, my left-hand side will be for those who prefer to speak Thai. And we're going to have about 15 minutes up to now. So sorry for this, but please listen to me. For the English group, you're going to focus on question number 1 and 2. For the Thai preferred group, you will be focusing on the question number 3 and 4. Just only 2 questions, please, so that we can have more time. Okay. That. Okay. รู้แล้ว แล้วแต่ facilitator. Okay. Since we have very limited time, so there will be the mixed method using both discussion and the post-it, please. Okay. So please proceed to the group, please. Please. May I count 1, 2, 3? And then after this session, we're going to proceed to the reception, which located on the 10th floor. So at the moment, please join the group. ขออนุญาตเรียนเชิญเลยนะคะ วันนี้ long day นะคะ Today is really long day, I know, but this is to make sure that we get all information or inputs in one day. So that tomorrow we can have more time in detailed discussion. Okay. Thank you. Can I count 1, 2, 3? 1, 2, 3, please. The time tick.ขอเชิญนั่งเลยนะคะ